So just a brief overview of the listening test, the listening part B test, in fact. Okay. It has a total of 6 workplace related conversation. These are mainly handovers, safety briefings, or updates that the administration gives to a group of staff members. So it could be two nurses discussing patient's treatment. It could be a junior doctor and a senior doctor discussing patient's physical examination finding or preoperative or postoperative condition of the patient. So these are basically the kind of communications that you might be witnessing day to day in your workplace. Now, what you have to basically do here is you have to answer 6 multiple choice questions. Okay, and each of the question, all of them will have 3 options. What are the question types that you can come across when you are doing listening part B questions? There are 2 main categories. You can have main idea questions, or you can have detailed questions. Now, in main idea questions also, there are some subcategories that you can have. Okay. The most common type that you have in the main idea question is the main idea itself, identifying gist or main idea of the conversation. Then you can have purpose questions. You can have agreement questions. And you can have function questions. So all the listening tests that you have in the classroom, each of that test focuses on a specific type of question. Okay. And in the detailed questions category, you have detailed question itself and future action, which means majority of the questions that you will get in the listening part B fall into main idea category, which means you need to understand the overview of the conversation as it is happening. So out of 6 questions, 4 questions will be based on main idea. It's not a fixed number, but on an average, the majority of the questions will be from the main idea category, and there could be 2 or 3 questions which are from the detail category. Now, the question type that we are focusing today on is future action. Now, this is again very common, right? Whenever there are handovers, a junior doctor giving handover to a senior doctor, maybe once at the end of the shift, a nurse giving handover to incoming nurse. In all those situations, what they would be mainly discussing is the patient's current condition and what is to be done for the patient in the future, right? So the tag itself indicates future action, which means you have to find out what is the next step that is to be done for the patient. And therefore, it falls into a detail category because the discussion will incorporate a lot of things. It may incorporate patient's current condition, it may incorporate what all things have already been done, and it would also talk about things that are to be done in the future. Your focus is only about the future actions. Yeah. So let us do it. Let us do one question in detail and then a few more practice questions so that you understand the approach. Now you can see here each of the question will have a context sentence. This context sentence will help you get a brief idea about what kind of discussion can you expect. So you have a context sentence here, then you have a question, and then 3 answer choices. So when you look at the context sentence, you try to think what all things will be there, what all things can be discussed within that particular extract, right? So it says physiotherapist briefing ward staff about an elderly patient. So here you don't have 2 people from the same profession, you have people from two different professions. So one profession is a physiotherapist and another is a ward staff or a staff nurse in the ward. So this, and they both are going to talk about one elderly patient. So it is not going to be generally about guidelines, it is not going to be generally about protocols, but they are discussing a condition or a treatment mainly related to physiotherapy for an elderly patient. Now, can you think about the discussion that they may have? Okay. If a physiotherapist is talking to a ward staff, I have given you two possible points that they may discuss: whether the patient is already on any exercise program, is the patient doing exercise as well? Okay. Can you add two more points here? Can you predict what kind of discussion they may have, or what all points might be included in their discussion apart from the points that I have added already? Think about it. Try to be into that situation and type your predictions in the chat box. What all things might be involved in this discussion? A physiotherapist talking to a nurse about an elderly patient. What all points they may discuss? Yes, they might talk about mobility. Can you think further about mobility? What sort of discussion can happen about mobility? Because it is a physiotherapist, so they would be concerned, or they would be involved in aids as well, different support measures or aids that you may be providing to your patients. Yeah, it could involve probably a wheel walker or crutches, or what sort of assistance does the patient require? Okay, and one more point. Can you think of one more point that would be discussed here? Yes. Yeah, so there could be two possibilities. The physiotherapist may be asking to the nurse if there are any updates from the consultant. Okay, if there are any updates in terms of how the next program is to be commenced, or what sort of exercises are to be done next. Is there any change in the type of exercises that are to be done? Or is there any plan for discharging the patient? Is there any plan for sending the patient to rehab now? So, any updates, or alternatively, physiotherapist may be giving an update to the nurse, right? So, physiotherapist and consultant might have decided certain changes, and then the physiotherapist might be informing about those changes to the nurse so that the nurse can be careful. Yeah. So see, just one sentence, the context sentence, just by reading that sentence, if we start thinking, we can actually figure out what kind of discussion would it be, right? And that is how you should use the context sentence. You should activate your thought process so that when the actual conversation starts, you're able to tune in with that. Okay, you're not just blank, but you are expecting certain things, and when those kind of things come in, you try, or you automatically become engaged with the conversation, and that is the key. In listening part B or in listening part C, in both those sections, it's very very important that you are fully engaged with the discussion. You cannot just finalize your answer based on some random words or some random phrases that you have heard. You actually have to engage fully and understand that. What is the next thing that you do is you look at the question, okay, and based on the question, you try to predict again from the answer choices if one particular answer is correct, what all things may be involved in that discussion. So the question is saying what should be done today to improve patients' mobility, right? What should be done today to improve the patient's mobility? So here physiotherapist is briefing the ward staff about something which needs to be done for the patient. So physiotherapist is not asking, but physiotherapist is briefing the ward staff about something that needs to be done today. Now, what kind of instruction may be the physiotherapist giving, right? They may be discussing a task that needs to be done on that particular day, which could be assessment of patient's mobility, it could be hiring a will walker, it could be giving reference to an occupational therapist because the patient is being discharged and you need modifications at home. Okay, so make a request for something to be done later that day. So it could be supervision, or it could be other referrals that are to be made, or it could be making sure that the patient is not involved in any other activities. They are free to commence the exercise program. Now, if you look at the answer choices, okay, what you do in the answer choice is again you try to underline the keywords and you try to also predict the kind of discussion that could be there if that answer is correct. So here, one option is that a new assessment is to be done. Now, if this answer choice is correct, it means that one assessment has already been done, but now another one is to be done. And it is about mobility, right? The discussion is about mobility, which means we can imagine that the assessment may be related to patients' mobility or their ability to move with or without aids. For example, the physiotherapist may say that, so far she has been working with crutches, but today when she walked in the evening, please observe or please try if she can, walk with a wheel walker, okay, or a walking frame, for example. So that is a new assessment, finding out if she's comfortable with a new type of device, or maybe it could be her capacity to walk for how much amount of distance they are able to cover. For example, if they are able to walk for a ward length, then it could be probably 2-3 rounds of that particular ward, so increasing the amount or duration of walking. Now, if B is correct, a short activity should be supervised. That means it is not about any assessment, but a specific activity that needs to be supervised. And a mobility aid should be provided for him, right? So all three options are different. All three of them have a different focus. Now, when you start listening, obviously you won't be able to hear the word exactly as a new assessment. You would not be able to hear the word short activity. Neither would you hear the word exactly as it is as mobility aid, right? But they might name that activity. They might name that device that a patient is going to need. So answer choices will still be inferential, but you are not looking for the summary of the whole discussion. You're just looking for a thing that needs to be done in the future, not the things which have already been done. Okay, so I'm going to play this audio for you now, and you have to choose appropriate option from these three options that you have. If I can get question for you here. Yeah, so here you have the full question. This is your keyword, and these are the keywords from the answer choices. Listen carefully and choose what is to be done today, okay, again, if it is to be done maybe 2 weeks later or 1 week later or tomorrow, then it's not the correct answer.
Okay, moving on to Mr. Alexander now. He had a mild stroke 3 weeks ago. Fortunately, he was able to get treatment here fairly quickly, and he's making steady progress. The main concern now is to encourage him to get up and move more than he's doing at present.
Okay.
Could you please take him for a walk along the corridor this afternoon?
Yeah, sure.
He's been up this morning, but not for long enough. He's reluctant to use his walking frame, but he really needs to use it to keep himself steady, so that's something to focus on. He's had intensive physio to manage his mild left-sided weakness, and he's determined to go back home as soon as his mobility improves. The OTs have checked his home to make sure it's safe for him, so we're nearly there.
Okay. Now I'm playing it for the second time.
Okay, moving on to Mr. Alexander now. He had a mild stroke 3 weeks ago. Fortunately, he was able to get treatment here fairly quickly, and he's making steady progress. The main concern now is to encourage him to get up and move more than he's doing at present.
Okay.
Could you please take him for a walk along the corridor this afternoon?
Yeah, sure.
He's been up this morning, but not for long enough. He's reluctant to use his walking frame, but he really needs to use it to keep himself steady, so that's something to focus on. He's had intensive physio to manage his mild left-sided weakness, and he's determined to go back home as soon as his mobility improves. The OTs have checked his home to make sure it's safe for him, so we're nearly there.
So something about each of the option was there. Now let me know what answer have you selected. Type your answers in the chat box. Okay. So now let us look at the transcript. Yes. So they did discuss about the patient's mobility, and there was a clear request. Could you please take him for a walk along the corridor? Right? And he's reluctant to use his walking frame, and he needs to use it, but it's not that the nurse has to provide it. Yes, he may be having already, because that is why it says he is reluctant to use it, but he has to use. So the nurse has to focus on, making sure that he is using it, but not to provide him, right? That is why, as we discussed, I mentioned it that you may be hearing one word about each of the answer choices, but it's not that the device is to be provided. Yeah, the nurse was supposed to take him for a short walk. So B is the correct answer here, and C can be ruled out because what the physiotherapist was saying is that the patient is reluctant to use it, and the nurse has to focus on it, or the nurse has to make sure probably that he uses it, but should be provided for him. This expression means that he doesn't have it already, and the nurse needs to arrange one for her, for him. That is not correct, right? So we'll have to pay attention to overall discussion, but we may not need to summarize everything. So that is why this type of question falls into the category of detail question. Now let us do a few more questions like this. So again, you have a context sentence here. A nurse reporting an incident to her manager. Can you predict what kind of discussion should this be? A nurse reporting an incident to her manager. Can you think of the discussion that you can expect here? When do you as a staff member usually have to report incident to the manager? Do you report every single incident? No, right? So what sort of incidents do you report to the manager? Yeah, it could be maybe some incidents because of, patient's reaction to a medication. It could be, some unfavorable circumstances. It could be, a form of therapy that didn't really go well. It could be patient's reaction. So basically, something was not all right, right? Something went wrong. There was an issue. Now, here it says, what should the nurse do first? That means from whom the answer should come, who would be giving us the answer, although it is a dialogue, a nurse and her manager. Our answer will be coming from whom? From a nurse or from a manager? These are very minute things, but very, very important. Manager, naturally, right? Because the nurse is first reporting, and then the manager would be giving instructions on how to deal with this now. And the question is also asking what the nurse should do first. Okay, and the first is also very, very important word here, because she might have to follow a long procedure, but what is the first thing that she has to do? What is the first step? So here it says fill out documentation, go to another area of hospital for assessment, or check patient's history for infectious diseases. So what the nurse has to do first? Does she have to fill in a document, or she has to go to another department, or checking patient's history? And here when you see infectious diseases, you can also predict further about this incident, isn't it? It could be probably an incident where she might have come into contact with blood or body fluid of a patient. Yes, that's when you have to check their history for infectious diseases. So this is how reading the question, reading the context sentence and answer choices can actually give you a brief idea about the whole discussion even before it has started. So now I'm playing for this one. Okay, listen to it carefully. I would play that also twice so that you are able to finalize your answer.
Sorry to bother you, but I need to report an incident. I've had some liquid, maybe blood, splash into my eye. I've already flushed it with normal saline.
Did this just happen now?
A few minutes ago. I was taking the drapes off after the operation and some fluid just flicked up.
Was the drape heavily soiled in blood?
No, it was fairly clean, actually.
Do you know the status of the patient? Any history of blood-borne viruses?
I'm not too sure. His notes are with him in recovery, but I can check.
You'll have to go straight downstairs to occupational health, where they'll advise and evaluate you and possibly take some blood. Then I'll help you fill in a formal risk assessment. Did anyone see the incident?
Yeah, Julie was helping me at the time.
Then we'll also need her to fill out some details.
Right, so again you had something about each of the option, but your focus is on what the nurse has to do first. Now I'm playing it for the second time.
Sorry to bother you, but I need to report an incident. I've had some liquid, maybe blood, splash into my eye. I've already flushed it with normal saline.
Did this just happen now?
A few minutes ago. I was taking the drapes off after the operation and some fluid just flicked up.
Was the drape heavily soiled in blood?
No, it was fairly clean actually.
Do you know the status of the patient? Any history of blood-borne viruses?
I'm not too sure. His notes are with him in recovery, but I can check.
You'll have to go straight downstairs to occupational health, where they'll advise and evaluate you and possibly take some blood. Then I'll help you fill in a formal risk assessment. Did anyone see the incident?
Yeah, Julie was helping me at the time.
Then we'll also need her to fill out some details.
Now, can you see which one is the correct answer? So checking the history was something that came from the nurse side, right? The nurse mentioned that I can go and check, but it wasn't the instructions that came from the manager. If you can see this in the transcript. Yeah. So it was the nurse who said that his notes are with him in recovery, but I can check. But manager had nothing to comment on this. Okay. And she said you will have to go straight downstairs to occupational health. They will advise and evaluate you and possibly take some blood. And then you will need to fill in a form. So that is the next step to be done. But the first step is to go to occupational health and safety department, where they will be assessed. So B is the correct answer here, not C. Okay? Because we had discussed already that the answer must come from the manager. What should the nurse do first? And again, when the nurse mentioned that I can check, the notes, there was no response from the manager's side. The manager didn't say that do that first. Okay, you need to do that straight away. No, you need to straight away go to the occupational health and safety department. So the first thing is that. Okay. Now for third question, I want you to interpret the question, interpret the answer choices, and type in what sort of responses or what sort of details can you expect if those answers are correct. What is the keyword that you have from the context sentence? What kind of discussion do you expect? And for each of the answer choices, what are your keywords? You need to type in the keywords for each of the answer choices. So this is typically a handover. What is the keyword in the question that would help you rule out other answer choices? For example, in the second question, we highlighted the word first, what the nurse has to do first. In the model question that we did in the beginning, the first question, we highlighted word today, what needs to be done today. So similarly, in this question, can you identify the keyword that would help you keep focus? Must, yeah, must and sure to do. What must the colleague be sure to do? So it is not optional, it is not a suggestion, it is not a recommendation, but it is a compulsion, something that has to be done. And from answer choices, you can see each of the answer choices are very different from each other. Okay? And if you be careful of now whenever it comes to future action, also be careful about the verbs. Okay, for example, here verbs were fill out, go to, check, because the question is asking what is the next thing to do. So that would always be an action that needs to be done. So also focus on the actions because that could make a huge difference. So here it says order a mobile chest x-ray. type in what is the keyword here. Monitor the patient's vital signs and check for a positive blood culture. Highlight the verbs and the keywords. Order. Yeah, order an X-ray. Monitor vitals. Yeah, monitor vitals and check for blood culture. And again, it says what must the colleague be sure to do. Okay, so if the things are to be done by other people, then it doesn't fall into the scope of practice for the colleague. You have to specifically listen what the colleague, the incoming nurse, has to do for sure. Okay, so I'll play this extract now. Again, I'll play it for 2 times so that you listen to it carefully before you finalize your answer.
The next patient is Robbie Fisher in room 8.
I just met his mother as I was coming in.
Yeah, she's understandably very worried. Okay, he's a 6-year-old boy, very unwell, admitted with hypoxia and respiratory distress secondary to a left lower lobe pneumonia. He was given a fluid bolus at 6 p.m. and was started on oxygen at 2.5 litres. He's on ceftriaxone. At around 12 a.m. you'll need to check that his vitals are stable and unchanged from now and oxygen saturation hasn't dropped. Dr. Stone needs to determine if his blood culture is positive, and if his respiratory status worsens, he'll most likely get you to order a mobile chest x-ray to check for an effusion.
Sure.
Okay, now I'm playing it for the second time.
The next patient is Robbie Fisher in room 8.
I just met his mother as I was coming in.
Yeah, she's understandably very worried. Okay, he's a 6-year-old boy, very unwell, admitted with hypoxia and respiratory distress secondary to a left lower lobe pneumonia. He was given a fluid bolus at 6 p.m. and was started on oxygen at 2.5 litres. He's on ceftriaxone. At around 12 a.m. you'll need to check that his vitals are stable and unchanged from now and oxygen saturation hasn't dropped. Dr. Stone needs to determine if his blood culture is positive, and if his respiratory status worsens, he'll most likely get you to order a mobile chest x-ray to check for an effusion.
Sure.
Right, so here you see the main difference between the main idea questions and detailed questions. Here you don't need to summarize everything because you have heard something about chest x-ray, something about vital signs, as well as blood culture. But the focus was on what the colleague must do. Type in your responses so that I can start discussing. If you are confused between 2 options, then write those 2 options. Okay, yeah. So now let me explain you with the transcript. How can we finalize the answer here? So if you can see here, they mentioned that at 12 a.m. you will need to check that his vitals are stable and unchanged. So this is something colleague has to do. Okay. Dr. Stone needs to determine if the blood culture is positive. So that is not something the colleague has to check. It is Dr. Stone who is going to do. And if the status worsens, he will most likely get you. He will most likely, that is not must, be sure to do. Right? This is how they usually trick you. You would hear something about each of the answer choice, and if you have not been careful about, being careful about identifying the focus of the question, then you can get pretty confused when the conversation actually starts. So, what a colleague has to do is to monitor patients' vital signs. Blood culture is to be done by or to be checked by the doctor, and the doctor probably would or ask them to order. That's probably, not must, the colleague be sure to do. Okay. Now, next question. A surgeon conducting a debriefing meeting with his team. Okay. Again, a workplace related conversation, but here a surgeon and the team. So this is most likely going to be a monologue, because the surgeon and then there is a team. And even if there is a dialogue, majority of the instructions will be coming in from the surgeon, because it is a debriefing meeting. What problem? Okay, so my keyword here is what problem are they going to follow up immediately? So immediately is my keyword. What is something that has to be addressed urgently? Okay. Now, whenever you are trying to highlight keywords from the answer choices, always be careful about words that are negative, that are words that are extreme, and blanket words. So here you can see all of them are negative. Procedures not running on schedule. So maybe I would highlight not running to schedule. Is that the problem? Okay. Equipment not available. Or is it the paperwork that is not done efficiently? Remember, again, you will have something about each three answer choices there. You have to find out which problem are they going to address immediately. Is it the schedule? Is it the equipment? Or is it the efficient paperwork that they are going to deal with? This time I would play it once only to check if you are able to do it.
Okay, we need to do our debriefing. Any comments about the case, Jackie?
Well, we were late getting started due to a delay in getting the surgical consent to come in, but I've talked to the junior resident and I think we just had a few crossed wires there, so it's sorted.
Yeah, we were busy in clinic this morning, but we were also delayed getting into this room because the case before us went over their time, which pushed us back. That's becoming a regular occurrence with that particular team. I'm going to ask our nurse manager to adjust their time slots based on the recent history of their cases.
We were also slow to get the portable films from radiology. There were several rooms requesting films, and radiology seemed short-staffed. That's unusual for them, but let's keep an eye on that, and if it happens again, raise it as a concern.
Type in your response. Which do you think is the correct answer? Okay, so taking a concern, there were a few problems and that is already sorted. So it is not something that they are going to deal with immediately. Then they talked about the delay, yes, in the previous surgery. And I'm going to ask our nurse manager to adjust their time slots. So this is something they are going to follow up immediately. How can I rule out C is here. They've mentioned that there was some problem in getting the films, but that is unusual for them. But let's keep an eye on that. And if it happens again, raise it as a concern. So right now they're not going to do anything about the delay from the radiology because that is unusual for them. This is for the first time probably it has happened. So they're not going to do anything about that problem. Okay. And paperwork has already been sorted. Question is asking what problem are they going to follow up immediately. So something that has been sorted doesn't need to be followed up. About X-ray, they're not going to do it right now. They're going to wait. If another incident, then they may go. So A is the correct answer here. Procedures not running to schedule. This is the correct answer. Okay, we have 3 more such questions. Okay, and we are going to now do all of them back to back. So we would do all of them and then I would discuss the answers with you. Read the question. Try and predict the kind of conversation that you can have here. Try and highlight keyword from each question and as well as answer choices. Okay. So we are going to do this 5th question now. And what I would be doing basically is once we have done these 3 questions, I would be asking each one of you to give explanation on the answer choices that you have decided so that it would be a concept check for me. I'd be able to understand if you are following the right thought process or not. Okay. So a nurse handing over to a colleague. I'll be playing this now.
In bed 12, we have Liam Ogilvie. Liam's a 45-year-old male who was involved in a motorbike accident and was admitted with a frontal lobe contusion. He's broken his right arm and hand and has had surgery, including metal plates inserted into his arm.
Right.
He's also got deep grazes on his left knee and ankle and stitches on his right leg and shoulder. All dressings have been changed this morning at 9 and he's on self-administered morphine drip as well as an antibiotic drip. He's had injections to prevent blood clotting and his pain's quite manageable with the medication he's on. The doctor's requested some observation and testing regarding memory loss, so that's priority this morning. His right arm's in a cast and he'll need regular monitoring and a physiotherapy sessions booked later in the afternoon. Somebody's coming to collect him at 4. I've just checked his vital signs and he's stable with blood pressure at 135/95. It's a bit up, so you'll need to watch that.
Now question number 6. Nurse on the orthopedic ward doing a handover. What does the nurse want his colleague to do first? Okay, that's the keyword. Make sure that you have typed in the answer for question number 5, or at least you have made a note so that you don't forget later on. Now I'm going to play this audio.
Now, Mr. Mitchell in bed 17 has had a hip replacement and has been assessed as being at high risk of developing deep vein thrombosis. The fitting of the compression stocking today was fine initially, though later he complained about it being slightly uncomfortable to wear.
Okay, not much we can do about that, I guess. What anticoagulant medication is he on?
That's written down here. He's just had his latest dose, so requires nothing more until 11 o'clock. I'd go and have a chat straight away about how vital it is for him to walk around, or at least flex his muscles every half hour or so.
Okay, I was told yesterday he can be reluctant to get moving.
Well, I'm sure he can be persuaded. He is taking plenty of fluids though, but please continue to monitor his intake during your shift. Thanks.
And finally, the last question now. It's an asthma nurse talking to a patient about managing their condition. What course of action does the nurse suggest to the patient? Undergoing the test, keeping a record of attacks, or modifying the use or the way in which he uses his inhaler. Yeah, and this is going to be the final question.
Okay, that completes your annual asthma review. We've discussed the possibility of a slight change to your technique with your inhaler, but having seen you demonstrate what you do, I think I'm satisfied things are probably fine.
Oh, right. And you think I need to watch my symptoms more, right?
Well, there seem to be a few new triggers for your asthma. It's a matter of writing down details about when and where you have an unexpected asthma attack and what happens exactly.
Okay.
It'll help us identify what the cause is.
You mentioned going to the hospital again to check out how well my lungs are working. Well, what's it called? The peak flow test?
You might need to do that again at some point, yes. For now, it can wait.